Have you failed the NCLEX or are you preparing to take the NCLEX again? Well, I've got you covered. In this presentation / video, we are going to be covering multiple choice questions, SATA questions and fill in the blanks. And I'm going to break down how to answer the questions. And also I've got some good study tips and study strategies. So let's dive in. So the NCLEX is basically a safety exam. And it's wanting the person who's taking the exam to be safe, efficient, and have good clinical judgment. It emphasizes the ability to make sound clinical decisions under certainty. It focuses on critical thinking, clinical reasoning, and it takes emphasis on prioritization, delegation, and patient safety. Basically, the NCLEX responds to emphasizing mastery of content rather than mere adaptive scoring, reflects the complexity of responses. So to have effective study strategies, it's crucial to focus on the understanding concepts rather than memorization. Also, practice lots of case studies, practice critical thinking scenarios, and we use reliable sources. So once you've got like your resources sorted out, for me, I use Saunders, Mark Clement. I also used Simple Nursing. Great, just type in on YouTube, you can type in your subject and Simple Nursing. It tells you everything you need to do in like short videos. That's what helped me. So tackling tricky questions, this can be very, very difficult, but there's a tip and an approach of how to do this. So when tackling them, try and focus on critical thinking skills to boost confidence during the exam. First of all, read the question. Read the question at least 3 times. Pick out keywords, assess the situation, eliminate incorrect options, and make an educated guess if needed, but just break it down. So all they're looking for is safety, no harm comes to the patient, and clinical knowledge, and apply it to the question. To manage your time efficiently, you need to basically give yourself a study plan of between 6 to 12 weeks, and this will give you plenty of time to study each category on the exam. I found it best to study between 50 questions a day, sometimes even 30. Read the questions, answer them, and then when you get to the end of 20, read over them, read over the rationale, and then that way you can digest the information rather than getting question overload. So you need to set the pace, prioritize questions, utilize breaks, practice timing yourself with practice questions to enhance management skills. And this is what like the effective way to help your time management. So here's an overall summary. Key strategies discussed: focus on clinical judgment, practical clinical thinking, master adaptive testing techniques, and prioritize understanding over memorization. Essential tips for success: focus on clinical judgment, practical critical thinking, master adaptive testing techniques, and prioritize memorization for the NCLEX. So here's our first question. Let's dive in. A nurse is caring for a patient who is on a ventilator and has a nasogastric tube. The patient suddenly becomes restless. The oxygen saturations drop from 95 all the way down to 88%. What is the first action the nurse should do? So first of all, we've got to think, why is the oxygen dropped from 95% down to 88%? So just think about it. Read the question again a further 3 times. and pick out keywords of what the question's actually asking you. So the question is actually asking, what has the nurse got to do first of all to find out why the oxygen saturations has dropped? So A, administer supplement oxygen. B, check the placement of the endotracheal tube. C, increase the ventilator settings. Or D, suction the patient's airway. So the correct answer is B. Well done. Check the placement of the trachea tube. The rationale. Restlessness and decreased oxygen saturation in a ventilated patient may increase an issue with the ventilator, or the trachea tube may become displaced. The priority is to check the placement of the trachea tube to ensure it is correctly positioned. So, question number 2. A patient with chronic kidney disease is being discharged with a new prescription for erythropoietin. What is the most important teaching point for the nurse to provide? So basically, we read the question a further 3 times. We highlight keywords and what it is the question's actually asking. So we break down the question. So we have a patient with a history of chronic kidney disease. They're being discharged. They're being dispensed new medication, erythropoietin. So what is the most important teaching point for the nurse to provide? So basically, they're looking for you to educate the patient in relation to this medication. So let's run through our answers. A, monitor for signs of bleeding. B, report any signs of fatigue or dizziness. Ensure to have regular hemoglobin level checks. Increase dietary iron intake. C, to ensure to have regular hemoglobin level checks. The reason being is erythropoietin is to use to stimulate red blood cells production, so monitoring hemoglobin levels is crucial and effective for the medication, and to adjust doing so if necessary. So here's some questions that you'll also find on the NCLEX Next Generation questions. There'll be case studies. So let's run through this question. 55-year-old female patient with a history of hypertension, diabetes, presents with symptoms of severe chest pain radiating down the left arm, shortness of breath, nausea. She has a history of smoking and is overweight. Her vital signs are as follows. Blood pressure is 160/100, heart rate is 105 beats per minute, respiratory is 22 breaths per minute, and oxygen saturation is 94% on room air. What is the nursing assessment for this patient? So if we look at the clinical background of what's actually happening here, she has a history of hypertension and diabetes. She's presenting with severe chest pain, so this would indicate like heart attack symptoms. She's nauseated, she's short of breath, she has a smoking history. Now all the vital signs are not within normal limits. Blood pressure is 160/100, heart rate slightly elevated 105, rest rate is 22%. Saturations are on a little bit lower than the normal aspect. So what is the nursing assessment for this patient? So basically, the answer would be to perform a 12-lead ECG. Given the patient's symptoms and history, there is a concern for a cardiac event that's occurring with the heart. A 12-lead ECG is essential for diagnosing the presence, location, and severity of any cardiac ischemic or infarction. The patient's ECG shows ST segment elevation in the anterior leads. What is the most likely diagnosis? Answer. Anterior ST elevation. myocardial infarction, stemmer. ST segment elevation is specific leads on an ECG is indicated of stemmer. The test for the myocardial infarction where there is a couple of blockages of the coronary artery. What is the initial management for this patient in the emergency department? Administer IV fluids, start oxygen therapy and administer nitroglycerin, begin broad spectrum antibiotics or perform a chest infection. The correct answer is B, start oxygen therapy and administer nitroglycerin. In the acute management of myocardial infarction, oxygen therapy is given to ensure adequate oxygenation, and nitroglycerin helps reduce the cardiac workload, dilating coronary arteries and also improving blood flow. So here's a different format of question, fill in the blanks. The primary purpose of administering blank to a patient with an acute asthmatic exacerbation is to reduce inflammation in the airways. What would you think is the right answer that goes in this box? Correct answer is corticosteroids. Corticosteroids reduces inflammation in the airways, which helps to alleviate symptoms of asthma and prevents future exacerbations. A patient with congestive heart failure should be monitored for signs of blank due to the risk of overload. What do you think this could be? Rationale. In CHF, the heart's inability to effectively pump blood can lead to fluid accumulation in the lungs, causing pulmonary edema. Monitoring for signs and symptoms such as dyspnea, orthopnea, and crackles in the lung is important. The nurse should monitor for when a patient is receiving anticoagulant therapy, as it is a serious side effect. What do you think they should monitor for? Bleeding, feeling sick, bloating. What do you think? The answer is bleeding. The rationale for this is anticoagulants increase the risk of bleeding by inhibiting blood clot formation. Regular monitoring for signs and symptoms such as bruising, hematuria, and gastronal bleeding is essential. So the correct answer is bile leakage. That's the correct answer. So the rationale is after a laparoscopic cholecystectomy, which is removal of the gallbladder, monitoring for bile leakage is critical due to the risk of injury to the bile ducts during surgery. Symptoms may include abdominal pain, fever, and jaundice, which basically means the patient would be yellow looking in appearance. Patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with worsening dyspnea. The nurse should prioritize which of the following interventions? A. Administer diuretics if prescribed. B. Provide supplement oxygen as needed. C. Encourage the patient to increase fluid intake. Or D. Initiate high protein. So basically, if you read the question, break down what the actual is occurring and what are the symptoms and what is the prioritization which the nurse should do. So basically, you've got a patient who's come in with COPD, they've got worsening dyspnea, which is basically worsening breathing. What should the nurse do to prioritize this? So the answer is B, provide supplement oxygen as needed, just because obviously it's worsening. So usually people with COPD, they run an oxygen saturation of 88%, and sometimes they don't want you to give oxygen because that's their norm, because they run at a lower level. But in this case, because they've got worsening breathing, they do need additional oxygen, and it can be titrated as needed until symptoms subside. So the rationale for this is the patient with COPD is experiencing worsening dyspnea. Basically, the breathing's worse. So oxygen is essential to improve oxygenation and relieve respiratory distress. Fluid intake and diet changes are not important and not the immediate priority in this acute scenario. A patient is receiving digoxin for heart failure, presents with symptoms of nausea, vomiting, and blurred vision. What is the most appropriate action for the nurse to take first? A. Administer an antiemetic. Check the patient's potassium level. Administer active charcoal. Contact the healthcare providers immediately. So again, we've got a patient who's presenting with heart failure, is feeling nauseated, is vomiting, is got blurred vision. So what is the most appropriate action for the nurse to take? So first of all, we need to break down the question again. Do we give an anti-sickness? B, do we check the potassium level? C, do we give charcoal? Or D, do we let a healthcare provider know immediately? B, check the patient's potassium level. The reason for this is symptoms of nausea, vomiting, and blurred vision could indicate that the tablet digoxin is basically toxic to the person, often related to electrolyte imbalances, particularly hypokalemia. Checking the potassium levels helps to determine if this electrolyte imbalance is contributing to the toxicity. So let's go through a case study. A 68-year-old male with a history of hypertension, diabetes presents to the emergency department with an onset sudden of left-sided weakness, difficulty speaking. His vital signs and blood pressure are 180 over 110, heart rate 92, respiratory rate 18, oxygen saturations 96%, and room air. What is the priority nursing action upon initial assessment of this patient? So the answer would be to basically perform a rapid neuro assessment. The reason for this is because the patient suggests a possible stroke. A rapid neurological assessment is crucial to determine the extent of the neurological defects and to guide further diagnosis and therapeutic interventions. The patient's CT scan reveals ischemic stroke. What is the most appropriate intervention within the first 3 hours of this sudden onset? A. Administer aspirin. B. Begin intravenous thrombolytic therapy. Start anticoagulant therapy or perform carotid endarterectomy. Begin intravenous thrombolytic therapy. The rationale: intravenous thrombolytic therapy is indicated for ischemic stroke within the first 3 to 4 hours of symptom onset to dissolve the clot and restore blood flow. Aspirin and anticoagulants are not used in the acute phase, and the carotid endarterectomy is later. The nurse should monitor for which of the following complications after thrombolytic therapy: A. Hypertension, B. Hemorrhagic transformation, C. Hyperglycemia, or B. Hyperkalemia. So basically, it's asking what you should look out for after somebody's had some thrombolytic therapy. And the answer is B, hemorrhagic transformation. So the rationale for this question is after thrombolytic therapy, there is a risk of hemorrhagic transformation where the ischemic tissue may bleed as the clots dissolve. Closing monitoring for signs of this bleeding and neurological changes is essential. Patient is admitted with a suspected myocardial infarction. Which laboratory test is most indicative of a myocardial infarction? A. Hemoglobin A1C. B. Brain natriuretic peptide. C. Atropion 1, tropi. Or D. The complete blood count. The answer is tropi. Which of the following are appropriate nursing interventions for a patient experiencing acute pain? So this is a select toilet applied question. A. Assess pain level, understanding the standardized scale. Encourage a patient to wait for pain to subside on its own. C. Administer prescribed analgesic as ordered. D. Provide comfort measures such as a heat or cold therapy. E. Reassess pain levels after administering pain medication. The answers are A. Assess pain level using standard scale. C. Administer prescribed analgesics as ordered. D. Provide comfort measures such as heat or cold compression. Reassess pain levels after administering pain medication. Rationale. Appropriate intervention for managing acute pain include assessing the pain level, administering analgesics, providing comfort measures, and reassessing pain after treatment. Encouraging the patient to wait without intervention is not appropriate. So remember A, C, D, and E. Assess, comfort, deliver meds, and evaluate. Keep the pain management on point with these steps. So again, this is a select all. Let's apply. These questions do come up on the exam. So you've got like 1, 2, 3, 4, 5 possible answers, and they want you to select the correct ones, the most safest ones, and what you do in this scenario. So which of the following are common symptoms of congestive heart failure? So let's go through them. So A, shortness of breath. B, swelling of the ankles. C, persistent cough. D, sudden weight loss. Or E, fatigue. So the answers are A, shortness of breath. B, swelling of the ankles. C, a persistent cough. And E, fatigue. The rationale. Symptoms of chronic heart failure include shortness of breath, ankle swelling, persistent cough, and fatigue. Sudden weight loss is not a typical symptom. Fun tip, remember SSCF, shortness of breath, swelling, cough, fatigue, and these signals could indicate CHF. Which of the following are key components of diabetes management? A. Regular blood glucose monitoring. B. Constant carbohydrate counting. C. Regular physical activity. D. Avoid all fruits. E. Adhering to prescribed medication regime. So basically, it's asking you what are the components of diabetic management. So you've got options from A all the way through to D. So what do you think they are? Just give her a sec to think about it. So answers are A, regulate blood glucose monitoring. Obviously, this is crucial when you're a diabetic. You need to know what your blood sugar levels are so we can adhere to the insulin as we should. B, consistent carbohydrate counting, C, regular physical activity, E, adhering to prescribed medication regime. The rationale behind this is key components of diabetes management include monitoring blood glucose, counting carbohydrates, encouraging or engaging in physical activity, adhering to medication regimes, avoid all fruits is not necessary. Fruits can be included in moderation. Remember, BCPM, blood glucose checks, carb count, physical activity, and meds on schedule, diabetes management. So this is another select all let apply. So which of the following are signs of a urinary tract infection in the elderly? A, confusion and delirium, B, fever, C, abdomen pain, D, painful urination, or E, increased urinary frequency. So the answers are A, confusion or delirium, B, fever, C, abdominal pain, and D, painful urination. The rationale behind this, well, with elderly people, UTIs may present with confusion, fever, abdominal pain, and painful urination. Increased urinary frequency is not always observed in older adults with UTIs. Fun fact, remember CFAP, confusion, fever, abdominal pain, painful urination are all signs of UTIs in seniors. Which of the following are important aspects of wound care management? A, keep the wound clean and dry. B, use a sterile gloves and dressing. C, change dressings as soon as they become wet or soiled. D, apply ointment liberally to the wound. E, assess the wound for signs of infection. So the answers are A, keep the wound clean and dry. B, use a sterile glove and dressing. C, change dressings as soon as they become wet or solid. E, assess the wound for signs of infection. The rationale proper wound care includes keeping the wound clean and dry, using sterile gloves and dressings, changing dressings when needed, and assessing for infection. Applying ointment liberally is not generally advised without specific instructions. Fun tip, remember CSDI, clean, dry, sterile gloves and dressings, change and infection check is effective wound care made simple. Which of the following are considered when caring for a patient with a cast? So this is again a multiple choice question, but with all let's select apply answers. So A, check for signs of cast infection. B, monitor for signs of impaired circulation. C, keep the cast dry. And A, allow the patient to insert objects into the cast to relieve itching. Answers A, check for signs of cast infection. B, monitor for signs of impaired circulation. C, keep the cast dry. E, assess for pain and discomfort regularly. Care considerations for the cast include monitoring for infection, checking circulation, keeping the cast dry, and assessing pain. Now, inserting objects into the cast is not recommended. I used to do this as a kid. I used to put a ruler down. Like, you're not supposed to, obviously, but fun tips. Remember ICDP, infection check, circulation monitor, dry cast, and pain assessment. Proper cast care with these tips. Which of the following are important factors in managing a patient with diabetes? Select all that apply. A regular blood glucose monitoring. A. B. Educating about the signs of hyperkalemia and hypokalemia. C. Providing a diet high in refined sugars. D. Encouraging regular exercise. E. Adhering to medication schedules. Rationale. Diabetes management involves monitoring blood glucose, educating about blood sugars, encouraging exercise, and adhering to medication schedule. A diet high in refined sugars is not recommended. Remember, BEED, blood glucose checks, education on signs, exercise regularly, and drugs on time manage diabetes effectively. Which of the following are signs of an allergic reaction to medication? A. Rash and hives. B. Swelling of the face or lips. C. Difficulty breathing. D. Nausea and vomiting. And E. Elevated blood pressure. So answers: A. Rash or hives. B. Swelling of the face. And C. Difficulty breathing. The rationale: signs of an allergic reaction include rash or hives, swelling of the face, and difficulty breathing. Nausea and vomiting and elevated blood pressure are not specific signs of an allergic reaction. Remember, RSD, rash, swelling, and difficulty breathing, key signs of an allergic reaction to watch out for. Which of the following interventions are appropriate for a patient with a suspected deep vein thrombosis? A. Elevate the affected leg. B. Apply compression stockings. C. Encourage the patient to massage the affected leg. D. Administer antiplatelets as prescribed. And E. Keep the leg immobilized. Answers: A. Elevate the leg. B. Apply compression stockings. D. Administer anticoagulant medications as prescribed. Rationale for the DVT management: elevate, compression stockings, and anticoagulants are appropriate. Massaging and immobilization are not recommended, because this could lead for the clot to break off and go around to other parts of the body. So remember ECA, elevate the leg, compression stockings, and anticoagulant management. Which of the following actions are important when caring for a patient with a tracheostomy? A. Suction the tracheostomy tube as needed. B. Ensure that humidification of inspired air. C. Change the tracheostomy tube daily. D. Monitor for signs and infections of the stoma sites. And E. Keep the tracheostomy cuff inflated at all times. Suction the tracheostomy tube as needed. So that answers A. B. Ensure proper humidification of inspired air. D. Monitor the signs of infection at the stoma site. So basically, when a patient has a tracheostomy inserted here, you need to make sure, it's like us, they need to breathe. This doesn't need to become black. They need to keep the airway clear. So the signs of this is you'd hear the patient, you'd hear like lots of fluid or noises around the tube. And then B, you'd ensure proper humidification. Basically, that's just like oxygenation with water that bubbles and it goes through the tube, and it helps keep the airway not drying up. It helps keep it moist and clear. And also monitor for signs of infection. So where the actual intercision of the tube is inserted, you want to make sure that it's not got any signs of infection. So that's what we'd look out for when we do this. Which of the following are critical signs of preventing the spread of infection in a healthcare setting? A. Perform hand hygiene frequently. B. Wear personal protective equipment as needed. C. Disinfect services regular. D. Limit patient's visit. Or E. Avoid contact with body fluid. So A. Perform hand hygiene frequently. B. Wear protective equipment, PPE as needed. C. Disinfect surfaces regularly. The rationale: key infection prevention steps are frequent hand washing, using PPE and disinfectant services. Limiting visits and avoiding contact with bodily fluids are additional measures, but not always practical or necessary for all infection control scenarios. Remember, APD, hand hygiene, PPE, and disinfection actions keep infections at bay. Which of the following indicates a fluid overload in a patient? A. Edema. B, rapid weight gain, C, shortness of breath, D, decreased blood pressure, or E, jugular vein distension. So answers are A, edema, B, rapid weight gain, C, shortness of breath, and E, jugular vein distension. Rationale indications of fluid overload include edema, rapid weight gain, shortness of breath, and jugular distension. Decreased blood pressure is generally not typically associated with fluid overload. So let's go through the answers. So you've got A, edema, which is just basically excessive swelling of an area because there's water building up. Then you have obviously rapid weight gain because of the excess fluid. The heart's not able to pump it where it should. Obviously, they get shortness of breath because the heart's having to work a lot faster and it puts pressure on the heart. And then you get jugular vein distension, where basically this is like protruding, and you can tell that the heart's working faster because it's trying to get the excessive fluid around.